The crisis in Central African Republic experienced a peak in 2013 with the clash of armed groups entailing massive displacement of people both inside and outside the country.
On the external level, we are planning a mission in the neighboring countries because due to the crisis, a large number of our fellow citizens are currently in Cameroon, in Chad, in Congo-Brazzaville, and in Democratic Republic of Congo.
With the support from the UNFPA headquarters, the West and Central Africa Regional Office not only provided technical support to the 4 countries hosting refugees, but also provided guidelines to better structure a global response consistent with the mandate and the mission of UNFPA, delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled.
There are about 400,000 refugees in the bordering countries. Among these people who had to leave their homes and their country, there are some pregnant women who need to give birth safely, there are some women who need family planning methods, and naturally, women who need to be protected.
The eastern region of Cameroon, bordering the Central African Republic, has experienced massive waves of refugees. According to UNHCR statistics, 125,000 refugees have been registered. In view of the problems originating from this situation, especially in terms of greater vulnerability of women and young people who reach the refugee hosting sites while being exhausted and without any means, UNFPA found it necessary to redirect some of its activities within the health districts affected by the crisis.
With respect to women and girls' protection, as you might know, these are vulnerable groups, and the outbreak of the crisis made their situation get worse. More than 2,000 women and girls have been registered as having experienced violence.
They killed my husband, and they brought his corpse in the hut, and they burned down the hut. That's why I came back here in Bangui. Her relatives who brought her here told us that due to the latter events, they had been for a long while in the bush. But in front of the given situation, they couldn't stay there and lose their daughter. So, as they learned that at the hospital of Bosangoa, there are some childbirth kits and medical staffs for good care of pregnant women, they were obliged to carry her on a bicycle until they reached the hospital. Some women have been raped, some have been plundered. They saw their small businesses destroyed, their daughters raped, their husbands killed. So, every bad effect of war, the Central African woman experienced it and still continues to suffer from it in their flesh, every day.
Originally scheduled by the United Nations within a 100-day strategic framework, the humanitarian action in Central African Republic has been extended in order to best manage the ongoing emergency situation, keeping in line with the priorities of UNFPA, which are sexual and reproductive health, prevention and response to gender-based violence, advancement of social cohesion, and reinforcement of young people's capacities for peaceful coexistence. 305,930 male condoms and 15,406 female condoms were distributed to young people aged 15 to 24. 3,332 young men and ladies have been screened as part of the struggle against STI and HIV. 83 peer educators were trained in order to prevent HIV infection and gender-based violence and to foster social cohesion. The areas of intervention of UNFPA cover 67 sites in Bangui and 9 prefectures through the offices of Bosangoa, Bembari, and Kagabendoro.
We are working with young people in terms of protection against HIV and STI, and we want to reinforce such ability. In addition, we want to take action in places where we have no office and where there are urgent and acute problems, as was the case in Zemio some time ago. At the very beginning of the crisis, the focus was put on men with weapons, but people ignored this group, which was seriously impacted and was at the epicenter of the crisis, and which was greatly affected, even more than men were. So UNFPA paid special attention to this group, and that was fortunate. When weapons are still crackling, I think it is difficult to see humanitarians working in the field, even though their mission is to save lives.
Thanks to UNFPA's support, 300 members from 35 national women's NGOs received training in the fields of conflict management and social cohesion. These NGOs that go and meet the population also give some orientation and guidance about the referrals in case of gender-based violence, especially sexual violence.
When we meet with them, we first introduce the several forms of violence and the drawbacks of such violence. We explain that to the people, and then we introduce the referrals, in case of violence, where the victims should go for specific help.
The zone office established by UNFPA in April 2014 in Bossangoa initiated a process for identifying the needs of the people and the NGOs working in the field, with priority given in its response to gender-based violence and reproductive health.
A large number of healthcare facilities have been plundered, and as I talk to you, many of them are not yet operational. The ones currently in function are those supported by humanitarian organizations.
Due to the crisis, everybody was in the bush, in the forest, and many complications occurred. These complications even resulted, in some cases, of maternal and perinatal deaths.
UNFPA intervened at the very beginning of the crisis to provide the hospital of Bossangoa with emergency kits.
Thanks to the emergency kits, we've been able to save the life of this girl.
The childbirth kits have been a source of motivation for people, and this helped reduce the number of home births, which could cause some complications in the health of pregnant women.
At the regional hospital of Bossangoa, we received some donation for partners, and we got almost everything. So in case of sickness, pregnancy or childbirth, women have to show up at the hospital and they will be welcomed because everything is free for the time being.
All commodities and equipment provided by UNFPA were disseminated to more than 70 healthcare facilities, thus meeting the needs of 1,800,000 people. All in all, from December 2013 to January 2014, 5,150 women have been given a dignity kit. 70,375 others received contraceptives, including pills, injectables, or implants. 62,947 prenatal consultations and 5,345 postnatal consultations have been carried out. 15,179 childbirths have been performed and 942 cesareans allowed, saving the lives of mothers and the newborn babies. Besides, 988 obstetric complications have been taken care of, and 842 women who underwent sexual violence received medical assistance.
The women who are pregnant, we help them give birth at home.
Sometimes there is no healthcare available while these women are about to give birth. So we give them a childbirth kit so that they can perform the childbirth safely with the help of other women in their neighborhood.
The crisis in Central African Republic, which led to community confrontation with a strong religious connotation, entailed within the country, as well as in Bangui, some enclaves where it is very hard for humanitarians to undertake their actions. This is the situation of the 3rd district, where UNFPA funded the building of a home for women.
We do not have access to safe drinking water, to lighting. Our children no longer go to school. If we are sick, we've got to take care of ourselves.
The women are disappointed. They want to shift into the 4th gear. Everything was burned down. Our parents can no more send us food here in the city. And we too. There is no more contact between us. The roads are blocked and people are hungry. So we must start everything again from the beginning. We made the decision to go in the barracks, where are to be found our husbands and our children. To go, why not, in the neighborhoods towards the belligerents, that is to say, the anti-Balaka and the Seleka, in order to talk with them. We have the entire world at the bedside of the Central African Republic, so we must grasp this opportunity. Mr. Ban Ki-moon himself came in our country and he met with us. He is willing to help us. The neighboring countries of ECCAS, the African Union, all these countries are by our sides. The means are lacking, but the government is struggling to mobilize resources, first internally, before seeking support from partners in order to provide a response to our compatriots. I call upon every woman who belongs to an association or does not belong to any association to join us so that we may work together for peace in our country. I just want people to disarm, to give up the weapons that are found in the country. And we only want peace.